In 3, 2, 1.
Good evening, DCPS families and the public. This is Louis Fairby, Chancellor for the District of Columbia Public Schools. We appreciate you joining us this evening for our final Reopen Strong Public Town Hall. Tonight, we will share with you information that we learned directly from you about your thoughts as relates to opening for the 2021 school year. What we heard, though, throughout that engagement are 3 key principles that we will be highlighting today. And we have a panelist of presenters that will go into greater detail on these 3 overarching themes. The first theme is what we heard from you is we need to continue to be thinking about how we promote safety and ensure that there are robust health and safety protocols as we think about opening the 2021 school year. We also heard from you the need to maximize learning in school and at home, ensuring that families have choice and if families choose a virtual experience, it is a high quality experience and represents a different experience than what families may have had in the spring. We also heard that if there's learning in school, it needs to be highly engaging as well. And we need to think about the not only academic, but the social emotional needs of our students. And then finally, promoting equity, ensuring that there's equity in access, whether we are thinking about technology or access to other supports and resources students may need to be successful in school. And so tonight we'll dig deeper into these 3 themes as relates to operations, health, safety, technology, and teaching and learning. We want you to know that we're committed to delivering on all of these 3 key principles as relates to our service to our students' families as we think about reopening strong for the 2021 school year. I also want you to know, beyond the focus groups, surveys, and the other ways that you've given us feedback, we most recently heard from you that you want to know whether or not we will be having school in person and hybrid throughout the 2021 school year. We expect DC Health to make a public health determination on the feasibility of hybrid instruction in person on July 31st. Once that decision is made, we can share more about the proposed schedules and how they would be implemented, or whether or not we would be in an all virtual posture for the opening of the 2021 school year. Also, just want to let you know that we're balancing the input that we're receiving, knowing that we're hearing from families who are fatigued and worried about the academic losses that students may experience by not having in-person instruction. And we acknowledge the most optimal learning experience is in person, but we also know that we must maintain safety. As we heard from some families who said, please ensure that students, staff are safe and only reopen schools when it's safe to do so. As I mentioned earlier, we'll continue to lean on DC Health to help us make that decision and determination on the feasibility of in-person instruction, but also know that we are committed to maximizing learning, whether that's at home or in school. Today, we have presenters that will go deeper into these topics, and our facilitator will be our Officer for Communication and Engagement, which is Shanita Burney. You also have an opportunity to hear from other chiefs, including our Chief of Operations, Chief of Teaching and Learning, and our Chief of Data Systems and Strategy. As I mentioned earlier, Ms. Burney will give you greater detail on our engagement period and what we heard and learned from your feedback and input. With that, it's my pleasure to turn our discussion now over to Ms. Burney, reminding you that throughout the discussions today and this evening, you'll have an opportunity to pose questions in the chat box, and we'll share more with you about how you will be responded to throughout the evening. And please know that we may have lots of participants and we may not be able to get to all of your questions, but we'll provide summaries of the questions provided and the answers provided. Thank you. Ms. Burney, we turn to you.
Thank you, Chancellor. Good evening, everyone. And again, thanks for joining us. My name is Shanita Burney, and I'm the Communications and Engagement Officer for DCPS, which means I'm responsible for our teams that lead our press and media, strategic and operations comms, in addition to the district's family and community engagement strategy. Before we get started, if you'll indulge me for just a second, I want to acknowledge that these are incredibly scary times. The impact this pandemic has had on our families, friends, belief in our country, and our mental health is just inexplicable. No matter how we deal with this on an individual level, the protection we want our children to have prevails above anything else. And so myself and the others that will hear from you today, including the Chancellor, have school-age children, share many of the same fears and questions and concerns that you have. We are being asked to make the same choices as many of you, and that choice is very individual, and we fully respect that. We know it's hard to trust us. We know that no matter our intent, that our actions don't always showcase us in a way that lends itself to public trust and transparency. But I assure you that your emails, your calls, your outreach has not fallen on deaf ears. We do hear you. We're working to be better for my child, for your child, for all of our children. So thank you for allowing me the space just to share that. So as we jump in and we start our conversation today, I want to share a little bit more about how we'll do the question and answer, the Q&A today. Building off of what the Chancellor said, during town halls like this, we literally get thousands of questions and comments. They come in extremely quickly. And we have 5 or 6 folks on the back end whose sole responsibility is to cull through, find themes, and then lift those questions up for our parents to respond to, for our panelists to respond to. Many of those questions get answered directly to the individual who wrote them, and then we take others and pull out trends and themes and share those back out with you through the town hall Q&A. Today will be similar. And, want to acknowledge that we absolutely will not get to every question this evening, but we'll do our best to push forward those that are being frequently asked and leave time after each presenter to answer a few specific questions you have about what they've shared. We'll also have some time at the end of the presentation for the Chancellor to take some questions from a variety of you. Your feedback is so important. And we want to remind you that, of the feedback that, if we go to the next slide, of some of the feedback that we heard from community members, families, and staff this summer. So recognizing that some of you may feel differently today than when you took this survey, it could have changed drastically at this point. But I want to share 3 main takeaways from that point in time. The first one is that students and families preferred scenarios where students had the option to attend school each week rather than alternating weeks. A second takeaway that I'll mention is that there's interest between 20 and 25% in each stakeholder group in virtual only. For high school students and students in wards 7 and 8, those rates were closer to 30%, according to the family survey that we partnered with the Office of the Deputy Mayor on. In addition, we heard that students in wards 7 and 8 who get to school utilizing public transportation are also more likely to prefer a virtual option. And then lastly, in June, between 25 and 30% of staff and families were undecided about next year. And so we have since that time, combed over this feedback multiple times, as well as considered sort of the different climate now and how potentially folks are feeling different, and considered those for the options that we'll talk more about today, as well as the 3 values that are guiding our opening. One is prioritizing safety, the other is maximizing learning opportunities, and then promoting equity of access. Those you will see addressed throughout the presentation here today. And so if we go to the next slide, before I turn it over to Patrick to talk through health and safety, I do want to recognize all the stakeholders who have been engaged with us over this planning process. And so you'll see here on the slide that there are a number of folks, and hopefully some of you are even on the phone now, that came from a family and community leaders that included, a variety of focus groups with targeted groups of DCPS families, presenting at some of our ward-based Ed Council meetings and a citywide survey. You'll also see that we took advantage of our established DCPS councils and boards. So those range from Chancellor's parent cabinets to student cabinets to early childhood parent policy councils, And so we took advantage of all of those established groups and gained some feedback there. And then finally, just want to acknowledge our internal stakeholders, that we spoke extensively with staff, teachers, school leaders, and of course, students again. So given that, and as we transition to the next slide, I want to hand you off to Patrick Davis, who's our Chief Operating Officer. And he's going to talk you through our 10 health and safety commitments that are guiding our thinking around reopening. Patrick?
Great. Yeah, great. Thanks a lot, Shanita, and thank you all for joining. Really appreciate you taking the time out of your schedule. I know all of our schedules have been turned upside down quite a bit given the pandemic, so thanks again for taking the time. And then building off the slide that Shanita just shared, thank you for all the input you've provided over the past few months. We've received a lot of emails and a lot of calls from all of you providing guidance and suggestions. We really appreciate that. That's really helped inform our thinking, and honestly, it's been a lot of information gathering over the past few weeks and months. And again, thank you for all that you've shared with us. I want to start by, we're going to talk about safety, but I want to start by just reiterating everything we're going to share in terms of operational planning and safety planning is grounded in the health guidance provided to us by our health partners at DC Health, OSSI, and the CDC. We are an education agency, and we rely on them to develop the health protocols. And I've really viewed our job, or my job, and the team's job is to operationalize those health guidance documents into something that we can give to schools to stand up so we can create a very safe environment for our students, staff, and school leaders. So on the slide, you'll see our 10 safety commitments. I'm not going to go into too much detail on this slide because we're going to go individually through the next slides. So if you jump to the next one. One of the key things and one of the key differences, if we come back in-person instruction, depending on this decision on the 31st, is one of the key changes, which I think many of you have probably heard about, but will be driving a lot of the planning and decision making, is that we're going to be limiting the number of people in our classrooms. Again, this is grounded and based on DC Health guidance. So our current planning and what we're modeling and planning for is having no more than 12 people assigned to a room. So that includes both students and staff members. We do have the ability to introduce a 13th member briefly into a classroom. So that could be pushing instruction or a school leader providing observation. But obviously that's a big change. I think most of you probably know our classrooms are typically between 20 and 25 students. So in general, about half of our student population will not be in a traditional classroom. Self-contained classrooms and some other early childhood classrooms will actually have smaller populations, just given the unique nature of some of the program elements. So that's obviously a key shift, and we'll talk about the schedule options for the hybrid, but this is really one of the key factors that's driving that. The other thing to note is, and we'll talk a little more about this in the upcoming slides, is that group of 12 people, 11 students essentially, will essentially be one community throughout the entire experience in school. One of the key principles we're trying to enforce is keeping cohorts together and really minimizing the mixing of cohorts. So that group of 12 people will really be a community for the rest of the school day, and as long as we need to implement these safe learning environments. You want to go to the next slide? Some other key changes is really introducing just health and safety protocols and practices into our normal school day. The first thing is that we're going to be providing masks for all staff members and students. We have enough masks, and we're planning for enough masks to have a new mask provided every day for every student that arrives in our building and every staff member that arrives in our building. We're making special accommodations to make sure we have smaller masks for some of our youngest students, also things like communicator masks for students that may need to read lips. So we're really trying to make sure that we're providing the right PPE, but also making sure that all of our staff and all of our students are able to have a good educational experience. Additionally, like you guys, we're making sure we're reinforcing hand washing. So we're going to be intentional about scheduling and planning for safe routines throughout the day. So that really starts with making sure we have access and time for really robust washing exercises with our students. So it'll be very, like I said, we'll be very intentional about scheduling these in each of the classrooms. Additionally, we're going to have additional measures to enter our buildings. You know, as I mentioned, schools going to look very different, and that's going to start with entering the building. I'll talk a little more about this in the upcoming slide, but one of the key differences this upcoming school year is if we do come back in person, we're going to be limiting the amount of visitors and people that enter our building. In fact, we're not going to allow visitors that don't have a scheduled appointment or family members to come in to our buildings, and certainly nobody will be entering without proper PPE and going through the right protocol steps. Next slide. Another key aspect of coming back safely is making sure that our buildings are properly cleaned. So this means we're going to be doing enhanced cleaning on a daily basis. Obviously, our custodians work hard every day and make sure all of our schools are great learning environments, but we're going to go, you know, a step beyond that and make sure that we're really focusing on providing that enhanced cleaning, which means cleaning touch areas, so things like doorknobs, handlebars, sinks, buttons, tabletops, really anywhere that students or staff hands can be. We're going to make sure we provide special attention to those areas and provide really robust, thorough cleaning in line with the CDC guidance, in line with the materials required for proper cleaning. Additionally, as you'll see in the schedule, we are planning for and dedicating a dedicated day in the week for a deep cleaning. That means our custodians will have an empty building with no students and staff, so that we're able to do really proper deep cleaning of all the spaces in our building. The other thing we're doing in terms of building systems is working to make sure our HVAC systems are working. Having fresh air and clean air in our buildings is a really important measure for us. So we're going to be working with our partners at DGS to make sure all of our HVAC systems are working and properly providing air conditioning, but also we're going to be doing enhanced features to increase the fresh air that goes into our building. So many of our buildings have what's called a direct outdoor air system. In line with the ASHRAE recommendations, we're going to be changing the controls to increase the amount of fresh air that's circulated through our buildings. But in addition, we're going to be doing enhanced filter replacements, again, in line with ASHRAE recommendations. And we're not going to be making a portfolio-wide approach here. It's actually going to be building specific. Our buildings all have different systems and have different flavors of HVAC systems. So we're going to be working with our partners to develop building specific plans to make sure we're able to have clean and healthy air in our classrooms and throughout the building. Additionally, again, with our partners at DGS, we're going to be prioritizing all work orders related to plumbing, specifically making sure all water sources are working, making sure that all of our hot water sources are working so that we can actually make sure we have all the spaces needed to do that proper hand washing, as I mentioned on the previous slide. If you want to jump to the next slide. Great. When I mentioned the 12-person cap, I mentioned really trying to limit the mixing of cohorts. So one of the key principles, again, following the guidance of the health professionals, is we really want to limit the mixing of cohorts and limit the transitions. So in practicality, that means many students will arrive and enter the classroom and spend a significant portion of their day in that one classroom. You know, most of our students and staff are used to transitions throughout the day, whether that's going to art, music, science, or for the secondary level, you know, transitioning from class to class. We're really going to minimize that. Again, really trying to keep these cohorts in small groups, and again, really trying to minimize the mixing of those cohorts so that we keep these groups essentially isolated from each other to the extent possible. We still will allow outdoor education. In fact, that's one of the things we're encouraging is outdoor education, outdoor learning, outdoor exploration, and outdoor activity. Obviously, getting fresh air and exercise is an important element of the day, and you know, I'm sure your children need a run around, and my son is no different. So we will be providing access outdoors, but again, that's going to be controlled and scheduled very intentionally, and the groups will be going out in their smaller group cohort sizes. So again, we're just really reducing the amount of time students are leaving their home classroom. Speaking of the classrooms like the rest of the building are going to look dramatically different, in line with the health guidance from DC Health and others, and really what you guys are all following in your daily lives. We're going to be setting up our classrooms to do the same, which is all of our desks are going to be spaced 6 feet apart. And one of the key things is all of the desks are actually going to be facing the front of the classroom. Classrooms have changed quite a bit over the years, and I've gotten more into group learning and facing each other and a lot more, project-based learning. But just given the health guidance, we're going to go back to the almost traditional style lecture setup where desks are facing the front of the classroom and again are 6 feet apart. We still will have communal spaces, but again, it's going to be on a scheduled basis, and we'll have occupancy caps, and they'll be used in those very small cohorts that I mentioned earlier. One of the key things that's going to just be different is we're working with our teachers and school leaders and obviously students. This is going to be very different, especially the first few weeks for kids. So we're going to be working on a lot of communication, a lot of signage, a lot of markings on the floors to really make sure that these new protocol steps are very clear for our students. We anticipate that students will pick up on this very quickly, but obviously in the first few weeks, this is going to be very different. Try to over-communicate, quite frankly, and provide as much guidance and visual cues for our students as possible to make sure we're promoting proper social and physical distancing. Going to jump to the next slide. I mentioned this a little bit in the previous slide, but the arrival and dismissal process will be very different this year. There's going to be new steps throughout, like the rest of the building. We're going to be promoting social distancing, so you'll see markings on the ground outside to identify 6 feet. So all of the queuing outside will be done in a very orderly fashion, again, aligning with the 6-foot protocols. But there's going to be additional stations, entering, before our students or visitors or staff enter a building. We want to make sure we're doing that in a very safe way. So one of the first things that students will experience is a hand sanitizer station. So at all of our entry points, we'll have outdoor hand sanitizer stations where students will first get their hands clean, and then we'll provide them a new mask every day. It's key that the hand sanitizer goes first as students are putting on a new mask. We want to make sure that their hands are clean. So as I mentioned, we will be providing and procuring centrally masks for students every day. Students will be allowed to wear their own mask, but we will ask that you as family members clean them if they're reusable, make sure they're cleaned properly. If a student needs them, again, we will have a mask per day per student and staff member. I mentioned this a little bit in the early, I have to go back one. I'll go back to 6. Yep, thanks. One of the key differences is that, I know a lot of you and really like to walk your students to the classroom, make sure they get there properly and safely, but again, to limit the visitors into our buildings, we are going to restrict family members from entering our buildings, especially during the arrival process. If there are emergency needs for meetings, whether it's an IEP meeting or a 504 plan meeting, we'll work to schedule those, but we will be encouraging as many virtual meetings with school leadership as possible. But again, no visitors without a scheduled appointment, and then that includes family members walking their students to class. So we will ask you to say goodbye at the door. Next slide. I mentioned this a little bit, but all of our students and staff will be going through health screening. So we're going to be providing a toolkit with a set number of questions that we're going to ask you as families to go through on a daily basis to make sure that all of our students are feeling well, and make sure if students and staff are feeling ill that they're not coming to school. We're going to be encouraging folks to stay home if you're not feeling well, and that starts with some key questions that we're going to be issuing to you all to work with your families on. Again, that's based on DC Health guidance. If a student does come or a staff member does come to our building and shows symptoms of COVID-19, we will be identifying a location in the building for that student or staff member to wait. We want to make sure that if anyone is showing symptoms, that they're separated from the rest of the student population in a very thoughtful way. But students will be isolated in a room, and we'll be obviously calling guardians to come pick the student up and obviously reaching out for any health guidance. But one of the key principles is to make sure that anyone who's feeling ill is not mixing with their cohort. And again, we'll obviously follow all of the DC health reporting protocols and all of the privacy protocols that go with that. Next slide. We know how important meals are for the day. Providing a nutritious meal is one of the most important things we do. I've been really proud of all of the meals that we've served during the pandemic, and we're going to continue that through through the school year. But it's going to look different, just like everything else. As I mentioned, we're going to limit mixing of cohorts so that the group of 12 will actually eat together too. So meals will be delivered to classrooms, and dining will happen in the classroom setting with that cohort. We're not going to be following guidance from DC Health, not mixing groups and not having large groups. So all of the meals will take place together in their classroom. So that's for lunch. Breakfast, we'll be providing grab-and-go breakfast meals as students enter. If they pass to the mask station and getting through the health steps in the exterior of the building, one of the first things they'll do as they enter the building is they're going to be grabbing a grab-and-go meal, and they'll take that to the classroom. And we'll obviously provide all of the necessary sanitizer and health protocols that are needed for a healthy meal. So that'll look very different. Next slide. So for all of this to be effective, we want to make sure that all of our staff are fluent in all of this. It's going to be a lot of new things. So we've been working with staff, and we're going to continue to work with staff over the next few weeks and month on training on these new operational elements. Really making sure that all of our staff are able to implement these. Obviously, we want to make sure that that all of our students are aware of these. So we're going to be working with our staff to make sure that our students understand all of these steps and understand the why behind all of these steps. So training will be a big part of our work over the next few months. I'm happy to share that, I'm going through some high-level information here, but we did release a large operational guidance handbook to our school leaders earlier this week. It's basically going through some of the topics I'm talking about here, but in much more detail, and we'll be working with them on over the coming weeks to review that and develop their own individual school plans. The guidance we provided is general for all schools. It provides the framework and guardrails, but all of our buildings are different, and all of the schools your students attend are a little bit different. There's some physical differences in the buildings. There's some staffing differences. So we'll be working with our school leaders and operational folks at the school level and here at central office to be developing school-specific plans to implement all of these safety measures. I mentioned PPE, but one of the things I just want to highlight is there's going to be additional PPE given to certain positions. So some of our self-contained classrooms may get additional PPE, but also staff members that may be potentially interacting with a potential positive case. In line with DC Health, we want to make sure that all of our staff have the necessary PPE to keep themselves safe as we work with all the visitors and students in our building. Next slide. And then finally, we've committed to giving families an option. So if we do come back with a hybrid option, one of the options that you'll have as a family is to opt into an all virtual option. So if that's the best choice for your family, you will have the option of not sending your students to the in-person learning opportunities and take advantage of the all virtual option that we'll be offering. That's my last slide, and I think I'm going to kick it back to Shanita for a few questions. I obviously covered a lot there, and there's probably a whole lot more, so happy to take any questions that came in.
Great, thank you so much, Patrick. Yeah, that was a lot of information, great information to share. I just want to remind the over 800 folks on the call that we'll be sending out the deck, this PowerPoint deck, as well as a recording of this discussion out so that you can share it with others, but also review it again at your own pace. There are a few questions for you, Patrick, and so I'll start with the first one. How much serious consideration has been given to the fact that parents, students, and staff travel on Metro and cannot therefore safely social distance, then possible infections enter with people every day?
Yeah, we know there's a lot of modes of transportation and methods that families take to get to school. We are working with our partners at DME and WMATA and DDOT, and we're making sure that WMATA has all their necessary safety measures in place as well. The reality is, we're not going to be able to control everything that happens outside of our building, and we're working with you all and relying on you all to make sure that all of us as citizens are following all of the guidance from DC Health to make sure that we're taking care of ourselves and our neighbors. That includes being on the metro or bus, making sure that all of our students and you all wearing masks at all times to the extent possible, keeping physical distancing. But again, it's going to be important that we all just stay on top of symptom checking. The moment that we start feeling sick, it's important that we stay home from work. It's important we keep our children home from school. It's really in the best interest of your children, but it's also in the best interest of your neighbors and classmates. So we really want this to be a community effort to make sure we're all taking this seriously. But we're going to be able to control what we can control, and I think we want to work with you to make sure you all are following the proper safety protocols outside of the school grounds as well.
Thanks, Patrick. So I want to remind folks that we're pulling the top asked questions, the most frequently asked questions for Patrick Davis to answer. One of the other questions is for the 13th person that can come and go. Is that limited to the same person, or just the principal coming in 1 minute, the coach another, the assistant principal the next, etc.? Still lots of people coming in contact with each other.
Yeah, it's not limited based on health guidance. It's not limited to one individual, but in general, we do want our school leaders to limit the amount of times we enter the classrooms. With that said, we want to make sure that our students are still receiving the necessary supports that they need. So whether that's pushing instruction or the school leader coming to observe, if it's an essential need to make sure our students are getting what they need, it is an allowable activity through the DC Health guidance. With that said, we're not going to be encouraging or asking our school leaders to push in without a reason. So it's not going to be just popping in on a scheduled basis. Anyone that's entering the classroom should be entering with a very specific reason. And again, that's making sure our students are getting the robust education experience that they deserve.
Excellent, thanks. Lots of folks are asking about masks. Will children have to wear masks for hours?
Yep, so we will be asking students to wear masks all day, with the exception of a few activities. So for our early childhood students, students will not be required to wear a mask while they're napping. During eating periods, students won't have to wear a mask, but the majority of the day, students will be asked to wear masks. Based on the guidance, this is one of the key measures to make sure we're limiting the spread of the disease, and we want to make sure that's our students are doing as well. We know it's uncomfortable. We all wear masks, and we know that it's an inconvenience and a struggle, but it's really an important safety measure. There are, if there are health reasons why a student can't wear a mask, we will be creating a waiver process. But for the majority of our students, they will be asked to wear a mask all day, and that's the same with our staff and anyone visiting the school as well.
Great. I'm going to throw one more question at you. It probably is one of our top 1 or 2 questions that we've been getting yesterday and today for operations, and that is around HVAC systems. Can you share how HVAC systems and filters are being upgraded for clean air? Yeah,
sure. I briefly touched on it, but we're working with our partners at DGS and vendors to evaluate each one of our buildings. So each one of our buildings is a little bit different, depending on the age of the building, if they've received a modernization or if they have not. So it's not going to be a one-size-fits-all approach. It's going to be a very building-specific plan, and that's grounded in ASHRAE recommendations, who's basically a governing group on providing healthy, clean buildings. So they came out with guidance on creating safe learning environments. And the key principles are increasing fresh air. So I mentioned doing that through outdoor air systems. The other thing is we're going to be increasing filters. So we've got relatively standard filters most of the time, but there are enhanced filters. So MERV 13, MERV 14 filters are being planned for in our schools. And when schools don't have access to an outdoor air system or fresh air ventilation, we're planning to and evaluating moving in things called HEPA filters, which are mobile units that help clean and purify the air. So it's going to look a little different each school depending on what they look like and the existing structure. But everything that we're doing is based on ASHRAE guidance.
Great, thanks, Patrick. I'm going to keep this moving and introduce you to our Chief of the Office of Teaching and Learning, Corey Colgan, who's going to speak to you more about our instructional learning options.
Thank you, Shanita. Good evening, everyone. As Shanita said, I'm Corey Colgan. I lead the Office of Teaching and Learning, so my focus is on the instructional models and curriculum and content. Additionally, I just want to share that I too am a parent of 3 DCPS students, and so understand the challenges that everyone has faced and will continue to face as we go into the next school year. So when we think about our instructional options for next school year, we want to introduce you to 2 key terms: hybrid instruction and all virtual instruction. As a reminder, we anticipate that the mayor will be making a final determination on July 31st about how we will start the year. But in order for us to be fully prepared for instruction this year, we need to have solid plans for both hybrid instruction and all virtual instruction, because we need to be sure that throughout the course of the year, it's possible we may move from all virtual to hybrid or from hybrid to virtual, and we need to be nimble and flexible in that way to make sure that we can maintain some continuity of the learning experience. One of the ways that we are doing that is through the development of both common curricular tools and resources and common technology platforms. So one of the things that we heard from families in the spring when we experienced the learning at home is that in some cases families had their students were expected to interact with many different technology platforms, and so we are organizing all of our learning and instruction and curriculum into a learning management system. The system that we use is called Canvas. Other tools that are technology tools that help teachers interact with students and help students do their learning can all be embedded into Canvas. So Canvas is sort of the umbrella platform that students will be able to log into. They will see all of their assignments. If the teacher wants them to watch a video or join a class for live instruction, the link to do that will be embedded right there in their Canvas course. So we'll be able to share more information on that as the school year gets closer, but I did want to share that we've been working very hard this year. This summer we've hired over 180 teachers to help us take our curriculum and digitize it into this learning management system. So that also makes it easier for teachers to design and deliver their instruction and to move from a hybrid environment to a virtual environment if that is needed throughout the course of the year. So we can go ahead to the next slide, and I want to be clear that what we're talking about in both the hybrid or the virtual models, there are a few things that we want to be true no matter which model students are participating in. One is that obviously they're experiencing joyful and rigorous instruction, that they have the opportunity to be supported in their individual needs. So of course, if they're a student with an IEP or an English language learner, their supports will be available to them whether they're in a hybrid or a virtual model. We also heard from families that prioritizing live synchronous interaction with teachers and with peers was really important for students. So we have been trying to design our models to ensure that that is maximized, and as much as possible, students will have that opportunity for that live engagement with their teachers. So on this slide, and you may have seen this in the mayor's press release last week or announcement last week, This is an example of what our pre-K through 5th grade and in our education campuses, pre-K through 8 campuses, what their 2 models would look like. So in this case, we would have a hybrid model where students would be in school in person 2 days a week, and they would be learning from home the other 3 days of the week. So in this model, you can see we have a group A that comes on Monday, Tuesday. There are no students in the building, as Patrick mentioned, on Wednesday to allow for the deep cleaning. And then a different cohort of students would come to school on Thursday and Friday. This allows for those smaller cohort and class sizes that Patrick was mentioning, and allows for that deep cleaning. We also, of course, have the all virtual option where students would be learning from home all 5 days of the week, and they would be supported with both live lessons, independent work, and some asynchronous lessons as well. One thing I want to mention that has been a big topic of discussion recently is for our ECE students. You may have mentioned, or you may have seen in the mayor's press release that we at that time were not offering an all virtual option for ECE. So for ECE, we were providing a hybrid option. But we did hear loudly and clearly that although there are challenges with an all virtual option for ECE students, and those are sometimes challenges felt by families trying to help their students to engage at home. We heard loudly and clearly that there is a lot of community interest in an all virtual option for pre-K families. And so that is something that I want to share that is definitely under consideration right now. We are looking into it, and we hope to be able to share very soon where we land on that. So just wanted to acknowledge that we had heard that message loud and clear. So shifting to secondary now, on the next slide, you will see an example of what hybrid instruction looks like in the grades 6 through 12. So here, because we have different constraints in the students' learning program, in terms of normally students in grades 6 through 12 are of course seeing different content specific teachers for all of their courses. Their hybrid model is based on 1 day in person. So they would actually take all of their courses, primarily all of their courses virtually on the 4 days that they are not in person in school. And then the 5th day in person in school would be a combination of advisory, which often includes academic supports, tracking how students are progressing in all of their classes and where they need additional supports. There's a lot of social emotional development, community building, sometimes other components of support that schools offer, such as college and career explorations and awareness, financial literacy, health. Those are all topics that could be covered in this advisory type day on the day that students are in person. But their courses otherwise will be meeting 4 days a week virtually. And then if students are opting into the all virtual option, they will of course they will be able to join classes along with their peers that are in the hybrid model. So they will be scheduled into their classes 4 days a week. And again, we'll have an opportunity for some additional supports, interventions, and some of that other content in a virtual space and advisory on their 5th day. So moving on to the next slide, we can just want to recognize that all of this is very complex, and there are not any immediate and easy answers, and this is challenging for families, students, and staff, but we are committed to creating the very best rigorous and joyful learning opportunities for all of our students. we really want to lead with equity in mind. And so what that means for us is that whether or not students are choosing to be in a hybrid model or in a virtual setting, that they are getting equitable access to quality instruction in synchronous settings, and that all students have access to the tools, the curricular tools and resources, and the technology they need to be successful in this environment. The last thing that I would want to say related to the hybrid learning is that it is possible we may, with equity in mind, need to prioritize certain groups of students with the highest levels of need for the in-person time if capacity constraints are in place. So I think I will stop there, and Shanita, see if there are any questions for me from the group.
Great, thanks, Corey. Yeah, we've had a couple come in. The one that I want to lift up is, sorry for the echo, to the extent you can, could you please outline a typical day for online learning? Like how many hours will kids be online? How will teachers engage students? Will there be assignments?
Sure, I can speak to that a little bit. I do want to be clear that our schedules will be under development and will be further developed once we are clear on the announcement next week. But we have been looking at both the experiences that our families and our staff had in the spring, as well as national guidance around best practices for virtual learning. And so what we know is that it's going to vary a little bit by grade level. Obviously, our youngest students are not able to sustain productive attention in a live setting as long as some of our older students are. But even older students do not and should not be expected to be engaged in a live synchronous lesson as long as a typical in-person class lesson might be, because typically in that in-person class, the teacher has some direct instruction, and then students may break out into small groups or do some independent work with the teacher circulating and providing support. And so we envision in the virtual learning model that there will be, we try to actually replicate some of those same scenarios, but in a virtual setting. So the teacher may have a short live synchronous lesson with either the whole class, or at the elementary model, we're looking at smaller groupings within the class. And then the teacher, after having that lesson, would advise the students on how they continue to do some assignments based on what they just learned. They may also be asked to utilize some of our blended learning programs and technology tools that help support their learning. All of their schedules will be outlined in these Canvas courses, which I was mentioning earlier. That learning management system has things like a calendar feature that allows students to keep track of all of their assignments and when they're due, when they have class meetings and things like that. And so all of these things combined, we think will help students feel like they have a more cohesive and manageable experience than maybe what some of our students may have experienced in the spring. And just to, I think, try to capture all the pieces of the question that you asked, I guess I would say, while we're thinking about shorter pieces of, or shorter amounts of time for the live synchronous instruction recommended for each grade band, there may be, like, for instance, in early elementary, it's recommended that live lessons are limited to maybe 20-25 minutes at a time, but the idea is that students would have multiple of those during the day, so that they may have the recommended guidance for elementary typically falls in the total 2 to 3 hours range over the day, but that is spread out. We'll be happy to share more specific guidance in the weeks to come.
Great, thanks, Corey. I'm going to keep us moving and introduce folks to Colin Taylor, who is our Chief of the Office of Data and Strategy, to speak more around how we're thinking about technology.
Thank you, Shanita. And I just want to echo what my colleagues have said, that I know as a parent how important it is that our kids are able to connect with a teacher, and so that's why really excited to just share some updates on technology this evening. I wanted everyone to know that we are, one of the ways that we're measuring success for the upcoming school year is on whether students can connect. So that is really important to us. And so that's why, first of all, our goal is to ensure that families have the technology, training, and support needed to navigate virtual learning. And that starts with our commitment to ensuring students who do not have access to devices at home have access. So that's number one. Number two, we know it's really important for families and staff to know how to navigate the platforms for virtual learning. And so to that end, we're doing a number of things there. We're really excited about a Parent University series on navigating virtual learning platforms. And we're also offering our staff kind of parallel trainings as well through the ways that we train teachers and staff on virtual learning platforms. We know there's a lot of lessons learned from the spring, and we're applying those to the work for this fall. And then finally, we're also excited to share how we're expanding technical support. We know that families, parents have been asked to step in and really, in some ways, facilitate virtual learning from home. And so it's important that you have the support needed to help troubleshoot, help students connect. And so we're doing two important things there in partnership with the Office of the Chief Technology Officer, or OCTO. So number one, we're going to be working with OCTO to stand up a DCPS family-facing call center for issues related to devices, logging into some of the platforms that Corey was talking about if there are issues there, passwords, all of those types of issues that we know parents experienced and students experienced in the spring. We want to make sure there's a direct line of support instead of going through kind of emails or other forms to get support. We want to make sure there's that direct technical support for families. The other thing we're doing is we're increasing and enhancing our technical support for schools and for staff, whether they will be in person or virtual. We want to make sure they have enough support to do what they need to do to be successful. So we want to just share a brief update on the Mayor's Multi-Year Empowered Learners Initiative to close the digital divide. And that is just that as we look to the upcoming school year, we're going to be leveraging the devices that we purchased as part of this initiative, as well as our additional investments for the upcoming year to ensure all students who need a device or internet will have access to that. Just on the next slide, I'll just explain that one of the things that we're excited about to share is that all the new devices that we are purchasing for the upcoming school year will be LTE enabled. So that is just like a cell phone. The devices don't need a separate hotspot or a wireless connection to connect to the internet. So we think that's a seamless experience for the students. And then, of course, we're also still leveraging the devices we've purchased in the past and pairing them with hotspots for students who need access to internet. And then lastly, I just want to share a little bit on how we are measuring need. As I said earlier, we want to make sure that we're providing a device for all families that don't have access to one at home. And so we released a survey yesterday to families to share each of their students' tech needs. And we're going to be reinforcing that survey. We know it's really important to make sure we reach all families. So we're going to be reinforcing that survey in a number of ways. We'll be sending it out, of course, through emails, through text message for families who maybe aren't accessing email, through robocalls for those who aren't able to access those means. And we also really want to make sure we're working with our community partners who are strong advocates for technology to disseminate the survey far and wide. We would just ask, please share this survey. It was linked in the message about this town hall. Please share with your fellow DCPS parents, and and others that want to request technology for the upcoming school year.
Great, thank you so much, Colin. I'm gonna, there's a question that's coming up that that's related to technology. I'd love to have the Chancellor come back online and respond. Will DCPS provide print copies of the technology survey to families who are currently disconnected, and will DCPS work with community partners to distribute and collect those print surveys?
Yeah, thank you, Ms. Barney, for raising that question up to us. And I want to be really clear to everyone tuned in that we will ensure that we leverage our partners. We'll collaborate with our partners to help us with outreach as relates to our technology access survey and better understanding the technology needs for our families. And as Chief mentioned earlier, as we went through the technology presentation, it's important to note that Chief Taylor referenced also using phones and other means to reach families. So we will reach out and we will ensure that we touch our families, and if we don't hear from families from the survey, we will be very strategic and intentional about making contact with those families.
Great, thank you, Chancellor. Another question that's come up is, what can parents do to help promote equity during this time? Is there anything more affluent parents, families can do to help the district as a whole, instead of just branching off to form learning pods with private tutors?
Yeah, great question. As a parent myself, I've already seen families organizing on various chat groups, and I think it's important that we lift up that we establish in the spring of last year in partnership with the DC Education Fund, ways in which people can make donations and contribute to helping us continue to meet the needs for families. We were able to secure dollars to help us with providing essentials to families during the time of need. And we also were able to leverage the donations to provide technology to families in need. So we would ask that families that are interested, please go to the DC Ed Fund website, and we'll also provide a post to that information as well, as where families can provide additional resources.
Great, thank you. What will happen when a staff member gets sick? Will there be a substitute applied for the classroom, and how do we ensure that the new person is safe?
Yeah, so the current thinking as it relates to substitute is that we would hire a group of substitutes that would be assigned to various campuses that would fill in when there's a need to support a classroom. As it relates to communication, we would communicate directly with impacted families should there be an infection in their particular cohort, and then there will be school-wide communications as appropriate as well.
Great. Can you share more about how specials will be included in virtual learning?
Yeah, so we want to maximize the learning experience, whether it's school at home. We believe it's important that students have a full experience. So we'll be creative with our learning at home experiences, and we're asking our educators now to plan and work throughout the summer in the DCPS curriculum for our core content areas, and also our specials as well, how it may look different in a virtual posture. For those students that would experience in-person learning in a hybrid structure, we plan to incorporate as many of our specials as possible in a hybrid structure whenever health conditions allow so.
Great. I'm going to throw in one last question before we, I know we're close to time. What is being done to ensure that special ed services are provided in an environment that is conducive to the special needs of children?
Yeah, so for our hybrid approach, as mentioned earlier, we'll continue to prioritize students that have very unique 504 or IEP needs. We also are working with our related service providers to ensure that we have them queued up properly to provide services accordingly, should we be in a hybrid posture to start the school year. If we're virtual, we will continue to leverage as many of the resources possible to provide resources at home and supports at home. However, knowing that there may be limitations given on the health conditions and our ability to make contact to students directly and in person.
Great, thanks again, Chancellor. So as I bring us to a close, I'm going to have the Chancellor do an official closeout, but want to go to the next slide and just share with you a few dates that are dates that you might be interested in, sort of marking on your calendars, flagging for yourselves. We will, again, as a reminder, send this deck out, so you'll have this in writing as well. We'll have the recording. But you see here what are some key critical dates coming up. Again, that virtual summer bridge, that's for August 10th through the 20th. That's for grades 3, 6, and 9. And then in order to ensure there's a one-stop shop for information, we're launching a new website, which will be DCPSreopenstrong.com. And we hope it will launch on July 31st, the same day as the mayor's update on the fall plan. And so be on the lookout for that as well, and we'll push that out to you. With that, I'm going to hand it over to Chancellor Fairby to close us out. Thanks again for joining us.
Thank you, Ms. Burney. Thank you to the chiefs for the presentation this evening as well. But more importantly, thank you to you families. Thank you for participating. Thank you for your questions. We know that there may be many more questions, and we'll continue to be responsive, and we'll follow up with regular communication to you as well. I wanted to let you know that there's so much gratitude among the DCPS team for your patience, your support, your flexibility, and knowing that we are in this together and we share responsibility in ensuring that our young people get what they need during this critical time. We know that this partnership has been not only beneficial as we close the school year, but throughout the summer, and we know it will be even stronger as we prepare for the 2021 school year. We thank you again for your support and continued partnership. We look forward to seeing you as we host our parent university sessions, and we look forward to sharing with you soon the determination on the feasibility of in-person instruction and our ability to offer hybrid learning. And again, that will be directly guided by DC Health. Again, thank you. Have a good evening.